Perhaps no section of a paper is more important to ensure reproducibility than the methods section. It's there that you'll explain what you did, hopefully well enough that someone else could replicate your experiment. That's the topic of this module in Analysis and Reporting. While it is always important not to say too much, most problems in a method section arise from too few details. The first consideration should be your subjects. What are the inclusion criteria? What are the exclusion criteria? These apply not just to human subjects, but to animal studies as well. Was age a factor? Did the subjects have to be healthy? Did they have certain conditions? Were there severity restrictions? Did some things disqualify subjects? Were the elderly allowed in the study? Were children? How about those with mental health conditions? These questions aren't just for informational purposes. They get to the generalizability of your study. More significantly, they may help determine how reproducible it is. More than one study has failed to be reproduced because the subjects in follow-up studies were different in some meaningful way from those in the initial study. The second consideration is materials and methods. These also need to be described as precisely as possible. You need to list every reagent, including manufacturer and even lot number. You need to discuss technical specifications of equipment you used. You need to describe your hardware, your software, and everything in between. When using animals, plants, or smaller organisms, you need to list everything about them too. What's the species, the sex, the age, genetics, physiologic status? Nothing should be left out. The third consideration is the study design. Was this a randomized controlled trial? If so, how did you randomize? Was it blinded? Double-blinded? How? Was it a cohort study? Prospective or retrospective? What allowed one into the cohort? What kept subjects out? Was it a case control study? How were cases defined? How were controls matched to them? Was it a controlled trial? What were the controls? Were there positive and negative controls? Why? Why not? A fourth consideration is the study procedures. What did you do? How did you do it? Why did you do it? For how long? A fifth consideration concerns your outcomes of interest. What's your primary outcome? How was it defined? Did you have any secondary outcomes? Subgroup analyses? It's important here not to deviate from the plan that you developed prior to beginning the study. Don't pick new outcomes if the old ones didn't go according to plan. And finally, a sixth consideration, the analysis. What statistics did you use? What did you control for? In this section, it's also important that you discuss your power and sample size calculations. I know there's a lot of questions here, but the bottom line is that someone should be able to read your method section, follow its instructions, and replicate your work. If they can't, something's missing, and there needs to be more. One more thing. In recent years, we've seen a lot of trouble because the experiments people describe in their papers are different than the experiments they set out to do. This has led some to worry that scientists are massaging their protocols to achieve significant results. Maybe they adjust the subjects. Maybe they change what subgroup they focus on. Maybe they change their analysis or their outcomes. To combat this, many have called for pre-registration of protocols and methods before studies are conducted. This can lead to a higher certainty that what is finally published matches what was proposed in the first place. We want reproducible results. This can only be accomplished when we follow proper scientific principles and stay true to our intent and objectives. This training module is part of a series funded by the National Institutes of Health.